Alright guys, this is our third video, and we're going to jump right back into guidelines for medication administration. So before now we've all been talking about the medication order, the prescription, we talked about the medication label, we also talked about calculating that medication dosage. So now we're switching gears to how we actually administer the drug to the patient when they're inside the clinic with us. So we're going to practice medical asepsis. We're going to wash our hands before and after medication administration. We're going to work in a well-lighted area free from distractions. We're going to follow the 6 rights of drug administration. We'll hit on these in just a few minutes, so hold tight on that. Always check for allergies prior to administration. Give only drugs ordered by a licensed practitioner who is authorized. So no student doctors or anything like that. It needs to be a licensed practitioner that needs to be prescribing or giving you the medication order. Never give a med if there is any question about the order. So if you're not quite sure what the medication order says, do not just assume. You need to go figure that out. Be completely familiar with the drug that you're administering. Look it up. There are drugs all the time in the ER that I run across that I am not familiar with. Luckily, we have a pharmacist on staff that I can, run and say, hey, what's this drug like? What should I expect? Those kind of things. What is it used for? But if you do not know, you need to look it up. It does not mean that you're incompetent. It basically just means that you are educating yourself. You are smart enough to stop yourself and be familiar with a drug before administering it. Always check the expiration dates on the label. We don't want to give patients any expired drugs. They may not be working efficiently and effectively if they are expired. Never give a drug if its normal appearance is altered in any way. So if you're like, well, this drug usually looks white, but it's kind of got a yellow tint, do not give that drug. Throw it away and find a new one. Double check the provider's order. Always bring the EHR with you. So bring that health record or the medication order with you. Give only medications you have prepared. Do not trust anyone. You only give medications that you yourself have prepared for the patient. You do not know what someone else did. Once prepared, do not leave the medication unattended. You do not know what people will do with different types of medication. So again, never leave it unattended. Be careful transporting. Obviously, you don't want to spill or drop any of the medication. If you do, dispose of the ones you dropped properly. With oral meds, be sure that the patient swallows, or obviously they're not going to get what they need. Shake all the liquid medications that contain a precipitate before pouring, so just to make sure it's suspended in the liquid appropriately. When pouring a liquid, you hold at eye level or place on a flat surface and squat to observe. You read the amount at the meniscus. This is the lowest level of the curve of the liquid. So when you pour a liquid into a measuring cup, you'll often see that it's actually at a curve. It's not necessarily a straight line. You read the amount by the meniscus, so that lowest level. Do not contaminate the cap of the bottle while pouring a medication. Keep all drugs not being administered in a safe storage place. So don't just leave the drug cabinet open while you're administering a drug to another patient. Carefully follow the procedural steps for the type of medication you are administering. So know how to administer that medication, not just what it is, but also how to administer it. Always keep safety precautions in mind and always follow our standard precautions, as always. So here are our 6 rights of drug administration. These were developed as a checklist of activities to be followed by those who give medications. So our 6 rights. We need the right drug. Be sure the correct drug has been selected. Compare the medication order with the label on the medication container. Right dose. If the dose ordered and the dose on hand are not the same, carefully calculate the dose. Have someone verify for accuracy. So just like those examples we used previously, you may want to have a second set of eyes with that Equinel example. Remember that we're going to be giving half a tablet. Run it by another MA, run it by a nurse. Say, hey, do you see that this actually needs to be just half a tablet administered in that dosage? Right route. Check the medication order for the right route of administration. This might be by mouth. This may be intermuscular, sub-Q, which stands for subcutaneous. We're getting there, guys. Rectally, all different types of routes. Right time. Check the medication order to make sure that the drug is being given at the right time or correct time interval. So some drugs need to be given in the morning, some at night, some twice a day, some once a day, some after meals, some before meals. So right time is definitely important. Right patient. Identify our patient using 2 identifiers always. Right documentation. This is our vital link between the provider, patient, and the medication or the medical assistant. So of course we need to be able to document what we did so that everyone is on the same page about what was administered. And be sure the data is accurate and clearly stated. So those are our 6 rights. Right drug, right dose, right route, right time, right patient, and right documentation. So administering oral medications. Oral medications are easily and economically administered. So oftentimes this is what our first level of administration might be. If the patient can swallow, let's do an oral med. 3 measuring devices commonly used in administration are the medicine cup. These come in various shapes and sizes, and you'll have them in the clinic. They're calibrated in either fluid ounces, fluid drams, milliliters, or tablespoons. Some of them have both milliliters and tablespoons on them, but they just they come in different shape sizes and different calibrations. But medicine cups are very common. You may have a water cup. This may be used to suspend different types of medicines in, or to pour liquids in, or just to use as water to take a pill. Small disposable plastic or paper cups. Average cups hold 3 ounces of liquid. Medicine dropper, calibrated in milliliters or drops. They're often included with the bottle of medication, so they often come hand in hand. The size of the drop varies with the size of the dropper opening. That's why they often come together. The angle at which it is held and the force exerted on the bulb, and also the viscosity or the thickness of the medication. So using the medicine dropper definitely comes kind of with a technique, and you need to know what you're giving and how exactly it needs to be given. All right, so that was our oral medications. Now we're moving on to parenteral medications. Parenteral medications describes the injection of a substance into the body via a route other than the digestive system. So the most frequently used parenteral routes include subcutaneous. This is just below the surface of the skin, subcutaneous. Intramuscular. This is going to be inside the muscle, within the muscle. Intradermal. This is within the dermal layer of the skin. Intravenous. Within or into a vein. Reasons for parenteral route. So why do we use this route versus then just giving an oral medication? So it's more rapid. The response time to the medication is quicker. Accuracy of the dosage. So we're able to know exactly how much medication is getting inside that body. Need for injection into a joint or for a local anesthetic. So sometimes we just need to get to a specific spot in a joint or to numb a specific spot, and we, in that case, need to use an injection. And inability to administer orally. So a patient may be unable to swallow. They may not be able to hold a medication down. They maybe have vomiting going on. Maybe a pediatric patient that can't take a certain pill or capsule of some sort. So our parenteral route would be used in this specific situation. All right, so what do we need to give parenteral medications? We need a syringe. So there's different types of syringes. And you'll see a picture here, this blue box, and these different types listed. We have standard hypodermic syringes. We also have irrigation or oral feeding syringes. We have a tuberculin syringe and an insulin syringe. So in this picture where it has the types of syringes, A and B are both standard hypodermic syringes. They're just in different amounts. So in that top one is a 5 milliliter syringe. In that second one, it is a 3 milliliter syringe. Below that, though, we have a tuberculin syringe, which is C. We also have D, which is an insulin syringe. And you can verify insulin syringe most of the time by seeing that orange cap. Sometimes we also use the insulin and tuberculin syringe may also be the same type. They are much smaller quantities, so the numbers will be much smaller on them. We do not have an example of an irrigation or oral feeding syringe here, but they're much larger, much larger. A lot of times they're like 60 milliliters on there. So needles. We also need needles to be able to give an injection. Common needle gauges range from 16 to 32. That's kind of the width or the size, how big they are. And then the length can vary from 3/8 of an inch to 2 inches in length. So let's talk about 16 to 32. So a 16 gauge needle is much bigger than a 32 gauge needle. So here it's opposite. As the number goes up, the needle gets smaller. I'm going to say that one more time in the opposite way. When the number is smaller, the needle is bigger. So often in the ER, we have large bore needles. So we often place 18 gauge needles and 20 gauge needles into a patient. Whereas smaller needles, like a 32 gauge, a 28 gauge, they may be used in the pediatric setting or for different things. Okay. And then they may vary from 3/8 to 2 inches based on where exactly that needle needs to penetrate. So is it going all the way into the muscle, or is it just going to be given subcutaneously where it doesn't need to be as long? So parenteral medication packaging. So the medication actually comes in different types of packages as well. So an ampule. We'll see here an ampule is actually this. This is an ampule. It's made out of glass. This is actually glass. And you simply have this little line is where it's serrated, and you'll pop up off this top and dispose of it safely because it'll actually be very sharp glass. You'll also use a filter needle to make sure that no shards of glass got inside this vial, this ampule, for administration. We also have a cartridge needle system. So this is actually a cartridge needle unit. This is a cartridge needle unit. You would simply put this system together, put the needle on it, and be ready to go. So that's kind of an all-in-one system here. I should mention for the ampule, you're going to be using a syringe, drawing up the medication inside this ampule. You may also have a vial. This vial may have a liquid or it may have a powder. So if it has a liquid, you're going to be using a syringe with a needle and sucking that medication up inside of that syringe. If it's a powder, you're going to be using some other type of liquid, a different type of liquid, reconstituting that powder into a liquid form. So taking the liquid that's inside a needle syringe kit, putting it into the powder, shaking it up, and then putting it back into the syringe with the needle to be reconstituted. Your homework is to watch these videos inside this PowerPoint. So I want you to watch this video about vials and also this video about reconstituting a powder medication. So there's a specific way to draw up medication from a vial. This is the vial. And there's a specific way to reconstitute a powder medication with in the vial. So that is your homework to watch each of these videos. And we will be practicing this in our lab. So I need you to be familiar with this procedure. Okay? Intradermal injections. This is our next topic. Again, there is a video here. I want you to watch this video before we come back to practice in skills, okay? Click this link, watch this video. You'll have to go back to the PowerPoint presentation itself to click this link, okay? I want you to watch the video of intradermal injections. This concludes our third video. Please stay tuned. I'm going to do one more. It should be the last one of our series, and we will finish out this Unit 5 medication administration.